I work for mHabitat, and we are a multidisciplinary team of designers and researchers and engagement specialists, and we're hosted by Leeds and York Partnership Foundation Trust. And I'm going to share with you today a brief summary of our Inclusive Digital Transformation Programme. And I have actually stuffed the slides full of more than I can talk about today, but I hope they will provide you with a useful takeaway. And please do get in touch if you want to find out more. So, as we are aware, the pandemic was a catalyst for the rapid digital transformation of health and care, but the unintended consequences were the triple whammy of pre-existing inequalities exacerbated by COVID-19 and by digital exclusion. And the people most affected by these inequalities are most likely to need health and care services. So in response to this, we embarked on a journey of discovery to understand how we might embed inclusion upfront into digital transformation. And the remote monitoring programme led by NHSX was one of the early projects that we connected with. We joined in close to home in the North East and Yorkshire, where we hooked up with the regional NHS England team and the academic health science networks. And we ran co-design sessions focused on 2 digital tools, TitoCare and a live call. Alongside that, we delivered a regional learning programme for 30 clinicians and technicians and other people working in digital transformation. And we developed a repository to share good practice and useful tools and guides and so on. And through this, and at the end of that discovery journey, we developed a framework for what we know so far, really, about what good inclusive transformation looks like. So we learned that the risk factors, which create barriers for people to benefiting from digitally enabled health and care, are multi-layered, they're complex, and they change over time. And they include life context, for example, where you live, what's happening in your life, your income, the conditions that you live with, and so on. And they can all create quite a complex picture. But also the more well-known risk factor around digital skills, confidence and motivation, and really importantly, the system side of things, so the accessibility of tools and the skills and confidence of staff. And it's clear to overcome these barriers, we need to join forces and pool resources across sectors. So whether that be the voluntary sector, local government, academia and the private sector, they all have a part to play. So as I mentioned, we ran co-design sessions with clinicians, care workers and patients in relation to 2 digital tools to test both inclusive and non-inclusive factors. Our TitoCare is an all-singing, all-dancing vital signs monitoring tool, and a live call, a finger pad ECG monitoring tool. And I think these are 2 potential real game-changing pieces of kit. And both pieces of kit in this circumstance were being handled by health and care workers in people's homes. So they will collect monitoring information, and then it could be accessed remotely by a consultant or a GP. So obviously the digital skills required in both cases were related to staff, not patients. But we discovered that life context can still be, in some cases, an excluding factor. So in TitoCare, for example, it's not always appropriate for people living with paranoia. And for a live call, there are physical and cultural and potential learning disabilities that can have a relation to exclusion factors. So we also learned that internet connections are not always easy to access in care homes, and it can due to patchy broadband, and GPs don't always have the right devices to receive the information. And we also, while we were there, learned a few things about the potential issues around flow of information, which we think could be used to improve the process. So, for example, having clear policies about who interprets the data, easy read information to help prepare patients, and training care workers to build their skills and confidence before we actually get into implementation. So our overarching conclusion was that these 2 pieces of kit were pretty inclusive, and actually they could be used to reduce inequalities and increase access, and very importantly, I think, improve the experience of care for some of our most vulnerable people. So that was a whistle-stop tour. And as I mentioned, we carried out a number of different projects last year with a number of different partners and parts of the system. And we pulled together this starter for 10 on what we think so far, what inclusive digital transformation looks like. And we did this because we want to help people who are interested, people, organisations and systems along their own inclusive digital transformation journey. So I hope this will be useful to some of you here today. And thank you very much for listening. And I'll hand back to Breed.